Good evening. My name is Dr. David Doman, and welcome to another edition of Housecall. What's new with the Montgomery County Medical Society? Find out right now. My guest this evening is Dr. Natasha Herz, President of the Montgomery County Medical Society. Dr. Herz, welcome to Housecall.
Thank you.
Briefly tell our viewers about your professional background.
I'm a practicing ophthalmologist in Rockville, Maryland.
That's for our viewers, an eye specialist, physician?
Yes,
Okay.
eye physician and surgeon. I did my medical school training at University of Oklahoma, and then I completed my surgical training at Baylor College of Medicine in Texas.
And how is it that you ended up in the National Capital area?
My husband drugged me out here.
And you're in private practice, solo practice?
Yes, when I came to town, I bought the practice of a retiring physician.
Very nice, very nice. So aside from your very active private practice, how did you become involved with the Montgomery County Medical Society?
Well, the physician that I bought my practice from pointed me to the medical society. As soon as I came to town, he said, if you want to get to know people and get involved, first thing you need to do is join the medical society. So I did, and quickly became involved in the Women in Medicine events as well as the Young Physician events, and they were wonderful. But that helped me become involved and aware of the things that the medical society does beyond just networking and helping your practice survive and thrive, which I needed lots of those tips too since I was just starting out.
Sure.
But yeah, that helped me to get involved and become interested in leadership and the advocacy that they do for the physicians and our patients. And after 10 years, here I am.
Good for you. How many physicians are there in the state of Maryland, roughly, and how many are in Montgomery County?
You know what, I don't have the answer for how many are in the state of Maryland. I know that we have about 1,600 physicians in Montgomery County that are involved in the medical society.
All right, very nice, very nice. So what do you perceive as some of the current healthcare issues statewide and certainly for Montgomery County?
I think some of the biggest challenges right now are the fact that premiums are pretty high for health insurance, as well as even if you're paying a high premium, you may have a high deductible still. Mm-hmm. And even if you have all of that figured out, there may not be that many physicians or specialists on the panel of physicians that your insurance covers. Mm-hmm. And those one or two that might be in the specialty that you need might be all booked out and you can't get in to see them right away when you need to. And so that access to care is a big issue for Montgomery County, even though we have a lot of physicians here. As that, there's a lot of increasing regulatory burdens that we have from Medicare as well as the other insurances. The penalties if you don't have an electronic medical record system, and if you don't, which I don't, you know, the things that you do to try to avoid as many penalties as possible, but it's a barrier to the patient-physician relationship.
Sure. Let's go over some of these in a little more detail. Let's talk about patient access and cost and this trend of higher deductibles. Is the Medical Society taking any positions on this or trying to serve as a resource for the public or in Annapolis?
Absolutely. We have a day that, at least one day that we designate as our day on the Hill, where many of us take time off of practice, time off of surgery, and away from our clinics to go and advocate for these issues for our patients to try to make things better. Now, there are things that are state issues and there are things that are federal issues. But the best we can do for the state ones is go to Maryland and Annapolis, and then for the federal issues, then there's another time that we go downtown and go to the Hill and have our say.
Very nice. Have you found that Governor Hogan has been responsive to the overtures of the Medical Society?
Well, in particular, I mean, we have had some great victories in advocating for medicine in Maryland. One of them that we've supported recently because of the opioid crisis, that they wanted to, the state wanted to help. They wanted to spend some money on the issue, and we advocated for some educational programs and things to help not only educate physicians to help prevent the problem, but also on the other end to help treat patients for rehabilitation after they've already had the problem with the addiction.
Very good. You mentioned earlier the escalating demands in terms of so-called electronic medical records. Explain to our viewers, first of all, what is an electronic medical record, an EMR, and what is perceived as some of the challenges.
Well, I know that it sounded like a really good idea when it was presented by the lobbyists to our Congress, to our federal Congress, that this would be a great idea, and all these different medical record systems would communicate with each other. They have to. It's a computer, right? But they don't. It's not the same program. So that interoperability, which would be the key thing, isn't actually what they would hope it to be. And furthermore, even though it helps them to keep track of all the patient information, so you can report on demographics, you can report on how many patients have this disease or those kinds of things, you can tally that up. I don't believe that it actually improves the quality of care that the patient gets. It makes it easier for the insurance companies to keep track of you and to nitpick if you dotted all the I's and crossed all the T's. But I don't believe that it actually helps with the physician-patient interaction at all. That detracts from that. What you're in it there for and what the patient is there for is for your time, so you can listen to them so that they can tell you. And if you're over there, yep, that's great, and what else? And you're playing on your computer trying to check all the boxes that the insurance companies require, then it really does pull away from the main crux of what you need for that physician-patient interaction.
Is that the reason that for your practice you don't have an electronic medical record?
That's part of it. Also, other than the initial startup cost, which would be around $40,000 or $50,000 to acquire a medical record system to switch everything over, even after that's out of the way, it's at least $1,000 a month in maintenance fees to maintain an electronic medical record system. I just checked into it, and so that's not worth it for me. I actually will take much less. I'll lose much less money in penalties if I don't get it. I am a solo practitioner. I have one office location. There's no reason for me to need to speak to other offices about patients or between other doctors. It doesn't make sense for me to have a medical record system, especially or electronic medical record system, especially when it's costing me $12,000 a year.
Of course. Certainly in your role as president of the Medical Society, I'm sure you get a lot of feedback from our colleagues in the community about electronic medical records. What are some of the concerns or complaints you're hearing about EMRs?
Really, it's the burden of documentation and all the boxes that you have to click. It's clunky, and the time that it detracts from being able to spend with their patients. And by the end of the day, even if they don't get it all done during the visit because they save it so that they can spend more time with the patients, then they have another couple hours after they're done seeing patients where they have to do charting at the end of the day. So there's that, and then there's the cost of it, of course, and then every year that the Department of Health and Human Services decides what meaningful use is, and they pass new laws to require those systems, those companies that provide those systems, say you have to be able to do this. And they're like, oh, sure. And they pass that cost on, of course, to the physician. And they say, you know what, if you want this to continue to meet the standards that they just passed, then you have to pay us this much money for your software upgrades, for your hardware upgrades. And it's just a constant cycle of having to spend more and more money. And if you don't do it and you want to switch to a different medical record system, the cost of that, the cost of switching all that information over, and they hold you hostage because you have to pay them in order to switch that over because they have all your information. So those are big issues.
So our viewers are then wondering, well, if you get this higher cost to upgrade or switch your electronic medical record, why don't you make up for that cost by charging more to the insurance companies or Medicare?
The insurance companies don't pay you for it. There's no provision for that. There's no way to bill them for that. They're not going to, I mean, I suppose you could send them the bill and they will send you a notice back that says we're not paying you.
But you can't charge more per patient to offset it.
Oh, no,
Yeah. And our viewers are probably wondering, well, why don't you charge more to Medicare?
They have a set amount that they will pay you no matter what you charge them.
So even though your overhead has been raised, you have no way to offset it.
That's correct.
You have to simply absorb the loss.
That's correct.
Okay. Let's go on to discuss other healthcare issues in the county.
Mm-hmm.
You mentioned the opioid crisis.
Yes.
What about e-cigarettes? Is there any position the county society has taken?
You know what? We haven't actually brought that up. We had mentioned just how successful over the years it's been actually with all of the ban on smoking in public places and the lack of advertising and the lack of movies with the actors chain smoking in them, how that has overall made a difference, and you see a lot less young people and even middle-aged people smoking than they used to, which is fantastic. Now the e-cigarettes, I don't think they've taken an actual position on that.
Now, we mentioned several times the Montgomery County Medical Society. What about the MedCI, the Maryland State Medical Society? How does that differ or overlap with the agenda of the Montgomery County Medical Society?
Well, the way that Maryland is organized, they have county medical societies for every county in Maryland, and we are components then to the state medical society. So if you're a member of your county medical society, you're automatically a member of the state medical society, and we all work together then to be unified so that when there's an issue that we're trying to fight for our patients, that we can go together then to the state legislature and lobby for that. So we're all going for the same thing.
And when you have lobbying in Annapolis, do you have lobbying just on behalf of the State Medical Society, or do the individual component societies send representatives as well?
There's only one group that's been hired to lobby for MedCI. But prior to that, before they get the issues that we want them to advocate for, we do meet together as, we have delegates according to how many members or how many physicians are members of each county society, and you get then that many delegates to represent those people. And you go in and you have twice a year, we have a House of Delegates meeting, and that's where we write proposals that we're hoping to change, that we see as a problem as a barrier to either practicing medicine or getting care to our patients, or the increase of generic drugs and drug pharmaceuticals in general. But all of these issues that we see as physicians causing problems to access of care, problems to our patient, being able to help our patients, then we can write these proposals and we take them to the House of Delegates, and then all of us nitpick the language and vote on it, whether or not it's what we want, the way we want it to be, and how we want that to be advocated for. And once we got it all tied up in a bow, then we have our lobbyists take those issues to the legislature.
Excellent, Dr. Herz. We're going to pause for a moment for a public service announcement. When we return, more with Dr. Natasha Herz, President of the Montgomery County Medical Society. We'll be right back.
A single ember from a wildfire can travel over a mile. You can't control where it will land, only what happens before it does. Visit fireadapted.org to learn how to protect your community from wildfires.
We're back. My guest this evening is Dr. Natasha Herz, President of the Montgomery County Medical Society. Dr. Herz, before we paused for the break, we were talking about a variety of issues in healthcare for Montgomery County, statewide, and indeed nationally. Let's go on to discuss the Affordable Care Act, so-called Obamacare. There clearly have been some successes and some problems with the ACA. So what is the position of the Medical Society? What are some of the perceived problems with Obamacare?
Well, Montgomery County Medical Society, along with the State Medical Society, MedChi, is trying to work through those channels and work with the American Medical Association to strengthen the Affordable Care Act in the places where it falls short. Because there are some problems. It definitely, I mean, we were all for the fact that it got rid of pre-existing conditions. We want there to be portability so that when somebody changes jobs that they don't lose their health insurance. We want all of the people that were uninsured and became insured, we want them to be able to continue to have insurance. That's a big deal. But the unfortunate result of some of these things is that those exchanges where people can get those health insurance plans, we've had a lot of insurance companies pull out of them, and they're not even providing. People can't buy insurance because there's nothing there anymore. The companies won't provide it; it's too expensive. And the plans that are available for a lot of people have high deductibles, so that they're paying an actually pretty expensive premium, and then on top of that, the deductible might be so high it might be $10,000. So that essentially most of their primary care, which would just be going to clinics and seeing doctors, would be out of pocket. The only medical expenses that would cover is if you had something catastrophic happen where you ended up in the hospital.
Right, right. So what are some of the thoughts being discussed within the society, or for that matter, MedChi, that perhaps will improve some of these issues?
I don't know that anybody has the exact answers for those things. I mean, we tell them the things that we still want them to keep, and got to depend on the number crunchers to figure out how the insurance companies then can lower their premiums and lower these costs, because instead of lowering the cost, everything has actually gone up, and that's got to be fixed. But we don't want that to be fixed at the cost of people losing their insurance, at the cost of people not actually being able to afford health care because the insurance plans themselves don't actually cover anything.
Now, of course, our viewers are very much aware there have been many, many attempts during the 7 years of the Affordable Care Act for the Republican Party to try to dismantle or reverse the Affordable Care Act. What are the thoughts of the AMA and MedChi and the Medical Society about throwing out the Affordable Care Act completely? Do they agree or disagree with that?
I think that they're working to strengthen the Affordable Care Act. Okay. They haven't scrapped it entirely. They just say, we need to take measures to strengthen it. I think one of the reasons it's been so difficult is because even though the Republicans hold the majority now, that they also agree we don't want to take people that have insurance and now make it so that they can't anymore. And it's always difficult to try to figure out, well, who's going to pay? Sure. Where's the money going to come from?
Right.
That's the big issue. That's the problem.
Of course. Let's transition to discuss what patients can do to make their visits more productive, in terms of the reality that there's limited time with the doctor and they want to get the most benefit for that allotted time. Do you have any suggestions for patients, for example, before they come to see you as a ophthalmologist?
Well, I'll tell you what a lot of my patients have done, and I think is great. They will have their medical history already typed up. It's beautiful. And they've got their medication list on there and the different doctors that they see for their different medical issues, their cardiologist, their primary care doc, and their contact information. It's wonderful, and they're like, here, you can have this. And of course, I put that as part of my record. And then they also oftentimes will have a list of what their most pressing concerns are about their eyes, in my case, about their vision. And that's really great, because then you often, even if you are focused on what you're doing, you can be talking about something else and then forget about that. Oh man, there was that thing I meant to ask? But that way, then they can always go through and
Sure.
ask their questions.
Now, we have touched upon a lot of the unique emerging stresses of being a doctor compared to 10, 20 years ago. We touched upon the electronic medical record. We touched upon briefly restricted or declining reimbursements. So you're in a unique position as the president of the Montgomery County Medical Society. And what kind of feedback are you getting from our colleagues throughout the county, throughout the state, about these stresses on being a doctor?
Well, we recently did a survey of our Montgomery County physicians, and we had a very good response. I would say close to 400 people responded to that survey, so it's not the entire population, but a good response. And some of the questions in that survey were definitely about burnout and stress levels and things. And unfortunately, between 50 to 60% of the respondents to the survey reported moderate to high levels of burnout, which I thought was really sad. People become physicians because they feel like that is their calling. They want to help people. They want that satisfaction they get out of helping somebody. Somebody comes in with a problem, an emergency, and you help them and you see them get
Sure.
better. That's why we went into medicine. And that relationship then that you have with your patients, that's where you get your satisfaction from. So then when you have these other stressors that are keeping you from spending time with your patients and being able to make those phone calls. I mean, it's important if a patient calls and they have a problem, and the doctor should be able to call them back and be able to talk to them, and that trust then that you have between the patient and the doctor, and that they know that you know them. That means a lot, and it does actually help you better diagnose their problem if you already know them and you have a history with them. But the erosion of that relationship, in that a lot of times with these big groups now that physicians are being forced to join so that they can make it financially, patients don't get to see the same physician every time. They often have to see whoever is available, whoever has space in their schedule. So you lose that relationship. I mean, it just, and then you've got other situations too with the EMR where it takes time away. It's just that's unfortunately what things are being pushed into, and I sure hope that solo practitioners and the small practices will continue to be able to make it even with all these pressures, because I feel a lot of satisfaction from my practice. I very much enjoy what I do.
So what is your sense about the doctors that are burnt out locally, nationally? What are the consequences for the doctor's emotional well-being and perhaps future career decisions?
Yeah, I feel like there's a real need to help with that, and to help reduce those stress levels, those pressures that are pulling them in all these different directions, so that they no longer feel the satisfaction that they originally did when they went into medicine. But some of the things that we're trying to do as a medical society to help with that is we formed a National Capital Physicians Foundation in the fall of 2016, and we're currently trying to get funding for it from corporate grants and from other public grants, and we have some of the hospitals have given money towards it, and then individuals too. But it's a nonprofit organization like the Red Cross, and we want to be able to use the funds that we get to help the physicians and our community. And so one of our focuses then at the outset is to provide a counseling service for physicians who are experiencing burnout, and try to help them to recover and to still stay in their practices and still serve the patients, and to restore that feeling of satisfaction.
So many of our colleagues, to rephrase the burnout, are actually depressed.
Yeah.
Is there any data to suggest that that's leading to early retirement?
I can't quote the numbers for you, but I know that there's definitely people that are retiring earlier because the financial pressures that they're facing, if they don't get EMR, or that their overhead is increasing and their reimbursements are declining, they either retire early because of that kind of stress, or just because they're burned out, they're tired, and they're just ready to move on. So we're hoping to reduce those numbers.
Is there any concern for the community, therefore, that as the Montgomery County population grows, if we have a growing trend for early doctor retirements, that patient access may be progressively more difficult?
Absolutely, and you can also see where there's, at least in our area, a lot of physicians have either retired or they've gone to concierge medicine, which allows them then to bypass the insurance companies and to limit then the number of patients that they care for so they can spend more time with them. But that still limits access to care. There's people that can't afford that. Or if they've already closed their doors and said, I have as many patients as I can care for, sorry, I'm not taking new patients. I mean, that's an issue. Or if you have all the smaller onesies and twosies that are joining the bigger practices, which I, of course, don't want to see that go away. But that all limits access to care.
The concierge model, explain further to our patients. That means no insurance, right?
Right,
Yeah.
right.
What do you foresee happening with the practice of medicine in Montgomery County in 5 years?
Well, I always think that even if the pendulum has swung in one direction where everything's consolidating and you have these big groups and all the smaller practices are dwindling, I always think that it's going to swing back the other way. I mean, I guess I'm an optimist, but I feel like that people will still start to see then the value of that and just the pleasure that you can get from being your own boss and being able to regulate your schedule, and because that's important to all of us to be able to still spend time with our families as well as to care for our patients. And I think that I really believe the pendulum's going to start swinging back in the other direction. But it'll also depend on decisions that are made at the federal level and what happens with the insurance market.
Of course. Well, Dr. Herz, I thank you very much for an informative interview. If our viewers have any questions, how can they reach you?
If you want to contact the National Capital Physician Foundation, the website is www.dedicatedtohealth.org. If you wanted to call either the Montgomery County Medical Society with questions about the foundation or just with questions about the Medical Society, it's 301-921-4300.
Thank you for joining us on Housecall.
Thanks for having me.
My thanks to Dr. Natasha Herz, President of the Montgomery County Medical Society. My thanks to my terrific team here at the studio. And most important, thank you to the viewer for welcoming us into your home. Let us know how we're doing. You can reach me at my practice website, montgomerygastro.com. As for our next show, it's going to be a very special one. My daughter, Dr. Sandy Doman, a well-known sports chiropractor in Miami-Dade County, will be reviewing what's new with chiropractic care, and she'll review her care for many professional athletes. It's going to be a terrific show. See you then next time for another edition of Housecall. Good evening.